have with us Dr. Benjamin Abott, who and his colleagues have been working at Brigham Young University to actually review the science of mask wearing. There have been, misstatements and contrary opinions about this, certainly in the early stages. I don't think we have that today. Dr. Abott can talk about that, but I've asked him to come and speak to us about his study and the information from mask wearing that they've done at BYU. So Dr. Abott, if you'd come forward.
Thank you, Governor, for the opportunity to share this important research. This research that I'm presenting today is based on over 130 scientific studies associated with COVID-19 and the effectiveness of masks. And it wouldn't have been possible without the volunteer work of members of my lab team. So please take a look at the study itself. It has all of the information and names there. We didn't receive any funding to do this work, nor do we plan on pursuing funding. This was a review that we did because we were concerned citizens and people with scientific training. We felt a responsibility to address the widespread confusion and sometimes misinformation that we saw circulating online and among our family and friends. We didn't have an agenda going into the research. We weren't sure what the answer would be. But again, don't take our word for it. Look at the report itself and look at the studies it's based on. I organized my comments around a few different questions. First of all, why is there so much confusion about masking? As the governor mentioned, initially we knew very little about this disease, and the recommendations that came out of the CDC and the World Health Organization were based on old research on other outbreaks. So based on that previous research, they recommended that masks would not be effective, public masking would not be effective. However, since it's a rapidly evolving situation, only months after the beginning of the outbreak, studies started coming out that showed a very different picture. And after those studies became available, those recommendations followed suit. That's how the scientific process is supposed to work. You make a conclusion based on the available evidence, and when new evidence becomes available, you change that conclusion. So this fundamental question, are masks effective at preventing COVID-19? It is now abundantly clear that masks are an essential tool at slowing the spread of COVID-19. One of the first clues that masks were effective came from the difference in the rate of spread and the mortality among different countries. So here I have a figure that shows the relationship between how early masking was implemented, and on the left side of the screen, the rate of transmission, and on the right side of the screen, the rate of mortality of this disease. And actually, this data has now been updated. It's a few weeks old, and in COVID terms, that's a long time. The relationships are even stronger now. But what you can see on either side is that countries that either had a mask culture to begin with, so many countries in Southeast Asia, for example, have long used masks to prevent spread of disease. They had much lower transmission rates and substantially lower mortality rates. That second number is very important, because it indicates that when masks are used, the disease is actually less deadly, even if you catch it. Now, the mechanism behind that is not yet known. It's possible that the amount of viral load that you get initially, if you breathe in a lot of the disease, it's more likely to be severe. If you only get a small dose, it might be less. Again, we don't know the reason, but this is very robust, that when masks are used, the mortality rate goes down. Now, if you could go to the next slide. The first one was a comparative study, and there's some issues there in establishing the cause, what's making those differences. So now we know from many states that have implemented masks, and this example comes from Massachusetts, where their healthcare system was having a rapid COVID-19 outbreak. It was exponentially growing. That's the pink part of the graph on the left. Universal masking was implemented in their healthcare system, so over 75,000 people were involved in this study. The rate very rapidly stabilized, and then the yellow part of the graph and green part of the graph is where universal masking was implemented also in patients, including those showing no symptoms. So here we see a longitudinal example that has now been repeated and observed in many states in many different contexts. So the evidence was starting to build why masks were effective. But if you go to the next slide, there's another line of evidence that's been that has recently come out showing us why masks work. So on the left-hand side, this is an image made with lasers shooting in front of someone's face. When someone is speaking, many tiny droplets are ejected out of their mouth, and the breath of air that comes from their mouth and nose can carry those several feet away from them. Wearing a cloth mask on the right, about 90% of those droplets are contained within the mask. So this is what's called source control in public health. My mask protects you, your mask protects me. That's all I've got as far as figures right now. But I want to address why are masks effective against this disease when it didn't look like they were against others. And Dr. Dunn laid this out very, very well. First of all, COVID-19 is extremely contagious. Those droplets can linger in the air, they can land on surfaces, and the virus can remain viable for minutes or up to hours. So long after someone exits a room, if they have the virus, those particles can remain. So keeping those droplets within the mask is really crucial. The second reason, which in my opinion is more important, is the rate of asymptomatic spread of this disease. So it's estimated that 50% or more of the new cases of COVID-19 are spread by people who are showing no symptoms. So I could be feeling completely healthy, and yet I still have the virus reproducing in my system. I could spread it to my loved ones, my neighbors, and strangers that I meet. So that's why preventatively wearing a mask appears to be so effective at combating this disease. Now, there was a lot of concern before and after we published this study about whether masks were safe. We had seen on social media claims that masks would reduce your oxygen level or increase your CO2 level. So we looked at all of the studies that had been cited by people making those claims and also did an exhaustive search of the literature. The conclusion was unanimous. Masks are completely safe for healthy individuals. This was a personal concern to me. I have 4 children who will be going back to school in the fall. I wanted to make sure that what I was asking them to do was safe, wasn't going to hurt their development. Masks in many laboratory studies have been shown to be safe. Doctors have used them for centuries. And the most convincing evidence comes from these countries that have long used masks, where young people, adults, and the elderly have safely worn masks with no side effects. Masks can cause skin irritation and foggy glasses, as many of us have discovered. And then there are certain individuals, if you have a severely compromised respiratory system, or if you can't remove and adjust the mask yourself because of severe disability or a child under 2. Those are the only classes of people that can't safely wear a mask. So the last question that I have is, will masks solve COVID-19? And researchers from hospitals, academia, universities, agencies, and the private sector have all come to the same conclusion based on this overwhelming evidence that masks are a very powerful tool that can reduce the spread of COVID-19, and when used in combination with other measures could really get this outbreak under control. But that's the final point that I want to make. Masks are not a silver bullet. And the one medical concern that there has been about masks is they can give you a false sense of security. So if you put on your mask and then go about your day as if there wasn't a pandemic, your mask is not going to protect you. So masks only are proven to work when used in combination with social distancing, frequent and thorough hand washing, self-quarantining if you've been exposed to the disease. But when those are used together, there is broad agreement and scientific unanimity that this could be our bridge back to normal, could have huge economic payoffs, and could get this outbreak under control.